Hello everyone. So today I am here with a new lecture of National Family Welfare Program, and in this lecture we are going to discuss about why it is required in India and what are the objective and commitments of India on the National Family Welfare Program. So let us start with the need of family planning in India. Now, so India is the second most populous country. Yes, so this is one of the major concern, and with the population there are some other factors which will lack, yes, like economy, like employment, yes, like food, and there are many things. So yes, this is one concern. The second most populous country of the world, which is harboring nearly 17.5% of world population, yes, and the population we can see it is nearly 17.5, but the land mass we will see 22.4% of the global land mass, yes. So means we can see how much the population density we have seen in the India, yes. Now coincidentally we will say the housing, so it also houses nearly 17.5% of world's protected couples and 20% of world's eligible couples, okay. So there are two terms, one is the protected couples and another is the eligible couples with unmet need. So protected couples are those couples who are using any mode of or any method of family planning. So they are protected couples, yes. Another is the eligible couples with unmet need, okay. So those couples who are in the fertile age group, but they are not using any method of family planning or any method of contraception, yes. So they are the eligible couples with unmet need. So we have nearly 20% of those of the couples, okay. Therefore the large population size of India not only impact its own, but it is also impacting the global health indicators, yes. Now we will see the high population, how it is impacting in other ways. So high population growth rate tends to retard, it will decrease the social and economic development of a country, okay, and which we are facing now, because it alters the age structure of the population, places a very heavy burden on education, on employment, on health services, okay. Of course, the more population will be, more the services we will require for the education, employment, health services, food, okay, or natural resources, more of the resources we are requiring, and prevents the raising of the quality of life. And more the population will be, of course there will be lack of all of these things which I have discussed, like education, employment, food, natural resources, ultimately it will decrease the quality of life of person. Thus family planning is very required, yes, for especially India, okay. Family planning leads to the reduction in birth rate of children and therefore the number of dependents in the family also. We will see the later at the later stages, of course, if there is a decrease in the birth rate of the children, okay, ultimately it will decrease the number of dependents in the family as well, okay. So there will be good quality of life. With less number of children to support, the standard of living the family will improve, yes. Now see, family planning is also necessary for rapid economic development of India, we have discussed previously also. As the growth of the population is reduced, in absolute numbers the per capita income will increase, okay, the per person income will rise. Simultaneously the growth rate of the labor force will come down, okay. So those who are not getting the job, those who are not employed properly, okay, so they will get it only after the control of the this population. This will have effect on improving the employment. The same I told you, in our country the unemployment problem can be solved only by taking this considerable extent, okay, if will reduce our population to a particular or considerable extent. Now India become, because this is one of the concern for India, so India has taken one of these steps. So India become the first country in the world to initiate one program, family planning program, okay. So family planning program, India has launched it in 1952, okay, and the main goal is to lower the fertility, to reduce the total fertility rate and slowing the population growth rate, and we will see the chart or the trends how the India is going. So, absolutely we can say that we have progressed, yes. So, we have achieved it, we have slowed the population growth rate. Now, see, since October 1997, the services of the and interventions under the family welfare program and child survival and safe motherhood program. So, there are two programs here, one is the family welfare program, another is the child survival safe motherhood, the program for the mother as well as for child. So, these two programs we have integrated with reproductive and child health program, RCH program. Okay. So, they are working in an integrated way, and they are providing some of the aspects, they are addressing some of the aspects like client choices, patient preferences, okay, service quality, standardized quality, universal care they are providing, gender issues dealing, okay, and underserved groups, okay, underserved groups or underserved areas, those who are not getting proper facilities, okay, those of the areas which are underserved areas. So, for those areas we have extended our program for this particular group as well, underserved groups or underserved areas including adolescents as well. Okay. Now, see, in 2012 there was one of the summit which is known as the London summit, okay, and under this summit or under this meeting, and this meeting is mainly on the family planning, and they have focused on the family planning at global level, okay, means international level. They did one of the meeting on the topic of family planning. It further paved the way for increased investment by countries, okay, and after this meeting what happens, there will be increased investment by the countries, by national or international agencies, academias and private sector, public private partnership in expanding access to family planning services, how we can reach it to all. Okay. So, for this there is a funding. There is a funding required, and these all of the countries, national, international agencies, these all agencies are working in an integrated way. And knowledge mechanisms to an additional 120 million women, okay, and girls in the world's poorest country. You will see especially the countries which are not accessing the facilities for family planning, okay, they are not getting the knowledge associated with it. So, the main concern is to provide the facility to these of the people, poorest countries by 2020. Yes. So, this is the most important we can see here is the 2012 London summit. Now, see, as a subsequent action after this meeting, what India did? So, the government of India adopted a new approach which places a well defined focus to a family planning efforts under the larger and more comprehensive umbrella. Yes, and what is this umbrella? Is umbrella of RMNCH+A. Yes, reproductive, maternal, newborn, child, health care plus adolescent. Adolescent here is up to 19 years of age. Yes. So, we have covered all of these, yes, all of these stages or all of these phases of a particular person. So, this paradigm shift was adopted, amazing the need, recognizing the need and long term goal of addressing a target free approach beyond the simple strategy of achieving population, okay, and stabilizing the population under the larger purview of improving maternal and child and adolescent health in India. Yes. So, this is one of the action which is taken after the London summit 2012. Now, we will see some of the interventions under the National Family Welfare Program. So, how will achieve this family welfare? Since then, the country has accelerated its interventions to focus on what are the points, see what are the focus areas. So, how will control the population, how will stabilize the population? First is roll out of new contraceptives. What are the new methods are coming? Okay. Any methods, there could be the physical methods, there are permanent methods, these all of the methods, they roll out of all these new contraceptives, okay, and also acknowledge the people, aware the people about it. Then institutionalization of fixed day services. So, there are some days, like we have fixed some days, okay, and on those days what the government is trying to do, they are trying to focus on the quality in family planning, yes, to provide counseling, to distribute the contraceptives. So, institutionalization of fixed day services with aggressive focus, so main focus, okay, very targeted focus on quality in family planning. Spacing methods between the two child is required, yes, for the health of the mother as well as for the child, yes. So, not to control only the population, but the quality of the population, yes, we are also approaching here. Now, revitalizing postpartum and post-abortion family planning services. If there is an abortion, yes, and after the delivery, what are the care services which is required for the newborn, which is required for the mothers, for the healthy being of mother as well as for the child. Now, enhanced focus on male participation, yes. We have included the mothers in all of the points we are talking about the mothers, but yes, see, we have enhanced the focus on the male participation as well, okay. And community based schemes through ASHA workers. I told you in previous of the lectures also, ASHA workers are working on a very ground level. ASHA workers, the accredited social health activist, they are providing counseling, they are enhancing the focus of the male participation as well as by providing or by awareing the males about the this stabilization of the population, yes. Streamlining and strengthening commodity security, public private partnership. And for all of the programs we have seen, not only with the one sector we can achieve it, we require the partnership, okay, from national, international we will see, yes, this type of partnership, public private partnership, partnership with all of the areas which are working, okay. By this integration only we can streamline, we can strengthen the program, yes. Now, other points, see what are the other focus areas. So, the government is also harnessing the expertise of various partners, okay, in the field of advocacy, okay, in the field of capacity building, okay, in the field of IEC, yes, and in the field of BCC, yes. So, we will talk about the IEC and BCC, means we are providing the education and communication, okay, and in the BCC what we are doing here is we are providing the behavioral change communication, yes. So, basically we will say this thing is the, we are providing counseling, yes, and providing knowledge or spreading knowledge, yes, to the public, okay. Now, see, new focused communications campaign, okay. So, how will provide this counseling or knowledge to the public? By some campaigns, okay. These campaigns, program management, quality improvement, evaluation and assessment. Feasibility studies are required, yes. Development of resource material and e-learning modules. Some softwares development are required to check out, to monitor, to track every day, yes. Social marketing is required, yes, where the people will go and they will see how it is impacting, why it is important to manage this population. Social franchising and provision of the skilled human resource. So, provide training to the health professional as well as for doing all of this, for monitoring, okay, for successful implementation of programs. So, these are some of the things which are required, yes, from a campaign to the skilled human resources. Now, see what are the objectives of the National Family Welfare Program, okay. So, what we are trying to achieve from this program is to stabilize the population, okay. On broad basis we will say, yes, to stabilize the population, to control the population. And how will achieve it? So, we will achieve by providing the family planning methods, Okay, if the couples, the eligible couples who are with the unmet need, if they will use all of the contraception method and will provide the facility at the stages of antenatal, intranatal or postpartum care to the mothers and provide the facility to the newborns, then ultimately of course will achieve the stabilized population as well as the healthy population will achieve. Yes. So, see, percentage reduction in unmet need for spacing methods among eligible couples. This is the first objective. Okay. So, what we are doing here? We are reducing the number of unmet need, yes, for spacing methods. Okay. So, the eligible couples who are in the fertile age and they are not using any contraception method. So, what we are trying to do? We are trying to reduce those numbers, okay, so that they can maintain some spacing between two childs, okay, then only the mother and child will be healthy. Okay. So, we are also we are not only working on the numbers, we are also working on the quality of the population. See, percentage reduction in unmet need for terminal methods. Okay. So, terminal methods can be permanent methods, yes, permanent methods among eligible couples. So, permanent method, there are some sterilization technique, yes. So, that techniques can be used for mothers as well as for the father, means for the women as well as for the man. So, they are also providing the reduction in the number of population. Then increase in contraceptive prevalence. So, the use of the contraception, that we want it to increase among especially the eligible couples, yes, who are in the fertile age group. Reduction in percentage of girls who are marrying less than age of 18. Okay. So, these are some of the objectives by which will stabilize the population, not only the stabilize of the population, but also will improve the quality of the population, yes, to provide the health care facility to women as well as to the child. Now, what is the India strategy? So, how the India is doing on it? See, we are focusing on spacing services, okay, space between two childs without disturbing the sterilization, yes. So, we are not using any terminal method or permanent method. What we are doing here is only providing the counseling or some of the contraception methods through which we can provide this space between the two childs in eligible couples, yes. Then there is a voluntary adoption of family planning, okay, and when there will be voluntary adoption of family planning? When the population is aware of it, okay. What are the disadvantages we are seeing with the rise of the population? What are the impacts we are seeing? So, if the population is educated, okay, then only we can see the voluntary adoption of family planning, and for this the ASHA workers are doing, okay, by the male participation or by providing the education communication, by providing the behavioral change communication, okay. So, voluntary adoption of family planning based on felt need of the community, okay, means how it is required. So, we will see, and on that basis we will implement it on the ground level, okay, by the health professionals. Focus on the male participation, this is very required, yes. So, next is the right based approach to family planning, okay. So, what are the rights based approach to family planning? So, we will see the health professionals, they are also working in this area, they are trying to give education to the population, and ultimately the population these eligible couples, they are working to reduce the population or stabilize the population by using the contraception or spacing methods or some of the other terminal methods, yes. Now, see what are the commitments. So, India's commitments on family planning, and these commitments are family planning 2020 India commitments. See, first is here, India is one of the principal protagonists, yes, in the global family planning 2020, yes. Action plan formulated in 2012. Okay, there was one of the summit I told you, London summit. Okay, after that India has taken one of the initiative. So India did some commitments placed in the context of Government of India's RMNCH+A. Okay, so I also told you family planning program is under this umbrella. Yes, RMNCH+A, adolescent. Reproductive, maternal, newborn and child health and adolescence program. The initiative has been structured to allow for focused, intensified efforts to achieve the following family planning 2020 national commitments through the decentralized actions of the state and district levels. Okay, so there is a one central body, of course it is working, it is providing some objectives or some visions to achieve, but these can be only achieved by decentralizing the state, district levels or the local authorities. Okay, if everyone is working at the local levels, of course it will go on the above hierarchies. Okay, if the primary healthcare centers have all of the facilities regarding which will approach for further decrease or to control the population, of course it will reach to the primary healthcare centers and then it will reach to the community health centers, ultimately it will reach to the state level or the national level. Okay, and then it will impact the global. Now see, in these are all the part of the India's commitment. So inclusion of family planning as a central element, okay, of our efforts to achieve universal health coverage. Yes, we are seeing there are some schemes also which are going right now, the government is launching, so that we can stabilize the population. Okay, and it will hope so it will work in the coming years. So inclusion of family planning as central element. So main element we have taken the family planning. Okay, our efforts to achieve universal health coverage. Okay, so health coverage to all and in equal way. Yes, the health facility should be standardized. Okay, it is given to poor as well as to the rich or the same type of healthcare facility. Increasing financial commitment of family planning to more than 2 billion. Yes, US dollar from 2012 to 2020. So this is also one of the commitment, the increase of the fund in this area. Yes, which is accountable nearly up to 2 billion US dollar. Sustaining the coverage of over 100 million women currently using contraceptives. Okay, so we want the coverage of using the contraception nearly in 100 million of women's. Okay, then reducing the unmet need by improving access to voluntarily family planning services and supplies and information. So before also I told you the unmet need, the couples, the eligible couples who are not using the contraception or any of the family planning method, what we are trying here, we want to reduce those numbers. Okay, and why they are not using it, there are many reasons, maybe they are not accessing it. Yes, so we want to reduce those numbers, unmet need, by improving the access of voluntarily family planning services, the supplies of or equipments and the information regarding it. Now see, expanding the basket of choices. Okay, so there should be the patient preferences on the contraception strategy, spacing methods. There are so many spacing methods. Okay, they can use the contraception methods are there. So there should be the choice, the basket of choices. There are many choices and patient can preferably select it. Yes, scaling up usage of current methods available. Yes, provision of services to all the beneficiaries, including adolescents, through an integrated RMNCH+A approach. Yes, this is under the umbrella, previously I told you. So the services should be provided to all of these: reproductive, maternal, newborn, child, health care and adolescent age. increasing access to contraceptives through community health workers. Okay, and when the community health workers will work in this area, they will ultimately be responsible for increasing the access of the services. Now, ensuring healthy birth spacing. So, I told you we are not focusing only on controlling the population, we are also talking on the healthy birth, yes, healthy population. So, ensuring healthy birth spacing. Strengthening sterilization services through quality service delivery, yes. Now, see, ensuring quality family planning services through updating existing and formulating new standard operating protocols, leading to skilled enhancement or providing better counseling and monitoring, yes. So, there are 2 points here is, one is enhancement of providers and best counseling and monitoring sessions, yes. Ensuring availability of free commodities through strengthened commodity supply system. Okay. So, the contraception supplies, they should be at all of these healthcare centers, then only the eligible couples can avail it. Now, addressing equity. So, I told you previously also, we require the universal access, we require the equity in the quality services. Everyone should avail the same type of facilities, yes, and poor or the rich, not basis on the standards or not basis on any of the background. Okay. So, addressing equity in access to quality services and supply for the poorest and most vulnerable section also. Fostering partnership with non-government organization as well. Okay. So, there is a public-private partnership. Without of these partnership, we will not achieve our program, the benefits of the program. Raising global awareness on the positive impact of family planning. Okay. Thank you so much everyone. I hope this is clear to all of you about this National Family Welfare Program. We will meet in the next session with a new lecture.